to have her and appreciate all that she's done in the last couple of days to make our visit so successful. Dr. Ali Khan, the Dean of the College of Public Health at the University of Nebraska Medical Center, and Dr. Kelly Lechtenberg, the President of the Midwest Veterinary Services Central States Research Center, the Veterinary and Biomedical Research Center. We thank all three of you for being here, and we'll begin with Dr. Beckham.
And thank you, panel, for having me here today. I appreciate the opportunity to provide some thoughts about surveillance and detection.
Would you mind pulling the microphone just a little closer, please? Thank you.
Is that better?
That's better.
Great. So I don't want to spend a lot of time rehashing some things that we heard this morning, and I'm going to just talk a little bit about our agricultural systems. And obviously the things that make them vulnerable, the things that make them robust are also the things that make them vulnerable, whether it's to a natural or intentional introduction of a biological agent. And we know that threats to our agricultural system come to us in a variety of forms. And this morning we heard about foot and mouth disease, we've heard about avian influenza, and then we heard a little bit about PED. But we know that they can come to us whether they're transboundary animal, emerging, and or zoonotic disease threats, and I'll talk a little bit about each of those. And we also know that they can result in great morbidity or mortality, a threat to our public sector, or have a potential to cause catastrophic economic consequences to our industries. And so you've heard a little bit about that this morning too. But many of these agents also do not require weaponization, and they can be easily obtained, and they exist naturally in areas where we have terrorist groups such as the Islamic State, Al-Qaeda, Boko Haram, and others that intend to harm the U.S. So not only that, but the risk of emerging infectious and or zoonotic diseases continues to threaten our animal, plant, and public health sectors. And in fact, it's estimated that over 75% of emerging pathogens are zoonotic, and those zoonotic agents are 2 times more likely to be associated with emerging disease events. So we know that we've been free of foot and mouth disease since 1929. We don't have African swine fever or Rift Valley fever, but we are increasingly at risk for introduction of these diseases and many emerging diseases. And we've seen in publications the economic consequences that could be had from foot and mouth disease. And a recent study at Kansas State University indicated that just in the Midwest, we could lose up to $188 billion to our livestock industries and our allied industries if we had an introduction of foot and mouth disease. But in addition to these publications that highlight the economic and social impacts, we've also recently experienced and witnessed the incursion of porcine epidemic diarrhea virus in 2013. High-path AI that you heard Dr. Marsh talk about in 2015, and last but certainly not least, Ebola virus disease in our public health sector in 2014. So these incursions certainly demonstrate our vulnerability to newly emerging and re-emerging pathogens. So in the case of PED, the industry lost 10% or 7 million of the piglets that were born to sows during the outbreak. During the high-path AI outbreak, the U.S. poultry population resulted in approximately 7.5 million or 7.5% of the U.S. turkey population and 4.1 million of the commercial chicken population being depopulated. So the total indemnity cost for the outbreak was approximately $191 million. But it wasn't really until 2014 when the Ebola virus outbreak occurred in the U.S. where the meaning of the term One Health took on new significance. So we talk a lot about the agricultural agents and the economic consequences, but when you start talking about zoonotic agents and the potential to public health, you're in a whole different realm. And I was personally involved in the Ebola task force in Texas and was involved in helping take care of the dog Bentley during the outbreak. So it was really during this outbreak when we had that issue that we began to realize the serious gaps that we have in our system. So we know that we have a lack of scientific evidence to support informed decision-making during that outbreak. We had a lack of available training for veterinarians, state and local animal health workers, first responders, and our medical counterparts as well. We had a lack of policies and procedures that would define appropriate handling of contaminated medical waste. And there was a lack of available scientific evidence that could support informed development of policies and procedures for appropriate handling or care of potentially exposed companion animal and or livestock. So really, it was during that outbreak that the term One Health came to the forefront for myself and the majority of the veterinary and the medical community. So during that, we had veterinarians emailing us, asking us how they were going to handle cases if they came into their clinics. And at that time, there were no really good policies or procedures available for us to give them guidance. For many of the diseases that threaten our industries, we do lack the medical countermeasures for early detection, identification, response, and recovery. And we have made significant advances in the U.S. with the licensure of the first foot and mouth disease vaccine that can be manufactured here in the U.S., and definitely the validation and deployment of molecular assays that are capable of supporting early detection and response to the National Animal Health Laboratory Network. But in order for us to more effectively detect, identify, characterize, respond to, and control and recover from an outbreak of a known or emerging pathogen, we still do have a lot to accomplish. So we heard this morning a lot about vaccines for foot and mouth disease and medical countermeasures, and we know that we have a lot to do there. But along with vaccines, we must also develop and validate new diagnostic technologies that can help us detect and identify both known and emerging pathogens. We must develop in collaboration with our industries and our stakeholders policies and procedures that can allow for an appropriate response to emerging disease affecting our industries. And for sure, we must work closely with our end user stakeholders and first responders to develop a robust, integrated biosurveillance system that is capable of capturing and analyzing data on animal, human, and wildlife health. Now, this biosurveillance system must also simultaneously provide useful information and incentives to encourage data owner and participation. We must work to develop data elements and standards that can be used across the agriculture and public health sectors, and simultaneously work to develop policies that will allow for efficient sharing of data while working to protect the confidentiality of our data owners. We must work to identify incentives and provide rewards for participation for early disease reporting among our agricultural and public health sectors. And we must prepare our first responders, veterinary workforce, and our medical counterparts through robust training programs in early recognition, disease response, personal protection, and biosafety. So we cannot simply discuss One Health anymore, but we must embrace it. And in our surveillance systems, we have to have surveillance systems that can share information across from the animal to the human health sector. And we need to have surveillance systems that aren't just agent or disease-based, but are more broadly syndromic-based, so that you can get on the early side of detection for these emerging diseases. And not only that, you have to have robust algorithms and epidemiologists that are available to support early alerts and understand what those alerts from such a system, what that would be telling them. And those individuals have to be available to support our state animal health officials. You heard Dr. Marsh talk this morning. There has to be some cooperation between the federal government, academia, and the states to support the states in the utilization of that information. So in a nutshell, for surveillance and detection, in 2012, there was a national strategy for biosurveillance that was put forth. The problem was that the implementation to that national strategy was never put forth after that. So one of my recommendations would be to take that national strategy for biosurveillance, which was really quite a robust strategy, and move that into the implementation phase. So like I mentioned, current systems and surveillance in agriculture are disease and agent-specific focused, and they lack they're limited in the disease scope, and they lack the ability to provide up-to-date and real-time situational awareness. And so the technologies exist today that we can put in the hands of our veterinarians and our producers. And you heard Dr. Marsh harken back to when he got that producer's call that said, "My birds ain't doing right." Those are the kinds of calls and things that we need to be capturing through real-time surveillance systems, through the technologies that we have today, whether they're iPhones or iPads, linking back to a data system where people can see alerts and then properly alert people to different things that are going on within the country. That surveillance system and the implementation of that is going to require engagement with our producers and our veterinarians and our doctors and our clinics out there, so that we can integrate that and provide them some incentive for participating in that. We have to be able to give them data back so that they get some useful information out of it, and that will encourage them to participate, to show them the value. So we have to give them those incentives. So I would encourage that public-private partnership, continuing to work with our state animal health officials and epidemiologists, not to mention, as Dr. Marsh mentioned, having having the labs able to send their information as well into databases, and that information being readily available to our state animal health officials. We need to continue to promote the technology development in those systems. We also need to continue to support the National Animal Health Laboratory Network and our reference laboratories by validating assays and providing the policies for use of those assays. We need to develop policies and assays that, as Dr. Marsh mentioned, that we can move closer to the pen side and support more advanced testing. The other thing that I would say that we need to do is we need to support the secure food supply plans, which also rely on premise identification so that you have the ability to do traceability during disease outbreaks, and tie those systems and the secure food supply plans with our surveillance opportunities and technologies so that we have all of that information in one database, or we can link that information and marry movements with what's happening on the animal health side. So we do need to continue to support the secure food supply plans and their implementation, and through that encourage states to develop more robust premise ID and encourage their producers to register through that system. And then we also need to, and this is certainly something I think we cannot overlook, we have to continue to support the global health security agenda. Because although we can have the best and most robust surveillance systems here at home, we need to be looking abroad for these agents as well. And through developing capacities in other countries and making sure that we know what's going on the ground in other places, it will better prepare us to look for those same things in the U.S. And so an example of that would be PED or a PRRS that you might see in a foreign country circulating. You can get in advance on that and understand whether your diagnostic tests are actually effective against those strains that are currently circulating. So I would encourage us not to just think nationally, but also continue to think globally and invest in these global initiatives, as that's going to help us have a better understanding of what's going on at a global level. And then lastly, but certainly not least, and then I'll wrap it up here quickly, is that we're building a $1.25 billion facility here in Manhattan, Kansas. And so our ability to do things here that we haven't been able to do before, like study Ebola and have those tests validated prior to an outbreak, all of that's going to exist very soon. But the fact that we're building a $1.25 billion facility, we need to make sure that we fund the programs that are going to go in that facility so that our scientists can continue to do the great things that they do and grow their programs and expand those programs and continue to work with their state partners in academia and the industry to develop the countermeasures and the surveillance programs and the One Health concept that we all know that we need to do with this facility. Thank you.
Thank you very much, Dr. Beckham, for the excellent comments, and we have a number of questions, but we'll take the statements from each of our panelists and then enter into the questions. Dr. Khan.
Thank you very much, Senator Daschle and members of the panel. I'm going to share some thoughts from two separate perspectives. So the first perspective is a career responding to these infectious diseases, and prior to leaving CDC, I was responsible for a $1.5 billion program that made sure Americans were protected from all public health threats, including these zoonotic diseases and bioterrorism. And more recently, as the Dean of the College of Public Health, we have the National Ebola Training Center with the responsibility of making sure that our national public health system, especially our healthcare preparedness system, is ready for Ebola and other emerging infectious diseases. And I personally responded to Ebola for 3 months 2 years ago in Sierra Leone. It sounds like earlier this morning you dealt with not just the animal and human consequences of zoonoses, but also the significant political, socioeconomic consequences of those diseases. That's true as you bridge over from the zoonoses into the zoonotic diseases. The classic bridge is obviously BSE that started off as a zoonoses, and then we started to see disease amongst humans, and the significant, not just human and animal impact, but obviously the political, social, economic impact. And then most recently, Ebola is an excellent example. And keeping with this One Health theme, my comments will mirror yours. They should mirror yours if we really do believe in a One Health theme. But, the Ebola outbreak was, I believe, 12,000 unnecessary deaths in West Africa, and really showed deficiencies in our global health security system and how this disease was able to, number one, propagate in these 3 West African countries for disease that we very much know how to prevent, and followed by, obviously, transportation and translocation into other countries. I don't want to forget deliberate threats in here. So maybe earlier today somebody talked about glanders and use of glanders in World War I.
No.
And then thoughts of use of glanders for other purposes. You've probably discussed purposeful use of FMD, but I want to remind people that for many of the bioterrorism diseases, classically that we would think of bioterrorism, so brucellosis would be on my list, and Coxiella, which causes Q fever, would be on my list. Besides the human impact, if there's spillover in the animal population, there would be animal consequences of the use of those diseases. Our number one threat to the health security of this nation remains a zoonotic disease, likely influenza, obviously, would continue to be the number one threat. Now, that said, I can say definitively that internationally and domestically, we are not ready for the next major pandemic. That was laid out, I believe, quite nicely in the Blue Ribbon Study Panel. It was laid out very nicely by the Trust for America Health report that came out late in December, Ready or Not, and lots of other similar reports. And I'll give you some data to support that. But let me sort of talk a little bit about surveillance and response activities, and at both global and domestic levels. A disease anywhere is a disease everywhere, as far as I'm concerned, and it's impossible to talk about just the U.S. You really have to think globally about infectious diseases if you're going to make sure that you prepare the U.S. for infectious diseases, and I'd much rather take care of it somewhere else than it ever finding its way here into Kansas or Nebraska. So WHO and FAO and other organizations have a global lead for preparedness-related activities. Their backbone for that work is a legally binding document called the International Health Regulations. Because of SARS, another zoonotic disease, by the way, that was the impetus for the new set of our international health regulations. And we've been fortunate, or unfortunate, depend on how you look at it, based on what happened with Ebola, that people have sort of understood why we really need to support the global health security agenda, which is slowly picking up and I hope will be continued in the new administration. Domestically, there are a number of systems, both for animals related surveillance and U.S. and human-related surveillance. There's a nice combination group that looks specifically at influenza, the North American Plan for Animal and Pandemic Influenza Diseases, as sort of that interface between what's going on between humans and animals. And there's numerous coalitions. The one I got the other day was the Coalition for Epidemic Preparedness Innovation, which is looking at vaccines and other diagnostics, and it may have been discussed earlier today during your conversations. Coming to the United States, a critical question we got asked and continue to get asked at CDC is, how prepared are you? And we actually have metrics to that. It's called the National Health Security Index. It's been in place for the last 3 years. We know our score is 6.7 on a scale of 10, with an increase. And when we first created it 3 years ago, I said the index itself isn't as meaningful as the trend. So the trend is we've gone up 3.6% in 3 years. So number one, 6.7 is not acceptable for a nation that spends what it does on health security. And we need to do better with the existing resources we have, without a doubt, and obviously find additional resources to address the gaps. And when we look at health security from a data-driven way, we're looking at surveillance systems, community planning, incident and information management, healthcare delivery, countermeasures, and environmental and occupational health. And we do best with a score of 8.4 in incident and information management. So nowadays, when I say to my public health and animal health colleagues, incident command system, national incident management system, EOC, they know what I'm talking about, at least. So I think we've fixed the language there on how we respond together. But there's a lot to do with the elements of that surveillance and detection to respond. And that sort of brings up the existing challenges as we think about our human-based surveillance systems and our animal-based surveillance and detection systems, and how do we make sure that they're prepared for natural infectious diseases, which worry me a lot, pandemic influenza, and for obviously covert and overt agroterrorism-related activities. We currently lack a reportable list of animal diseases in domestic and wild animals, which is different from the U.S., where from human health, where we do have a notifiable disease list for humans. We still do not do very well, and I'll just tell you in my human health domain, without even adding in the animal domain, to really fuse sources of information from multiple places and put it together to get a sense of what's going on in our communities, make sure we have that coordination with law enforcement that would be necessary for bioterrorism in the human health case. So that's just the difficulties on the human health side, let alone trying to link that to the animal health side and putting that all together. There's also, as you heard, lots of issues around vaccination, medical countermeasures, and diagnostics that have not been resolved currently, including how do you differentiate naturally occurring from deliberate diseases and vaccinated animals versus non-vaccinated animals, and all the necessary training that we need to make sure of the public health workforce and the veterinary workforce to recognize these diseases, make sure they can report them, and people are adequately trained to respond. I was asked to provide 2 to 3 specific suggestions. So my 2 to 3 specific suggestions are leadership, will, and resources. So leadership, globally, I believe that we need a UN Undersecretary for Health that can work across the various domains and recognize that health-related issues are not something that's just a World Health Organization or an FAO responsibility. It's a political level of responsibility with the highest levels of government, which is what the UN specifically is charged with. And that could deal with the next pandemic influenza, it could deal with climate change, all sorts of other issues that are health-related. And I believe we need to do the same thing in the United States. We have excellent individuals across the federal space who are interested in these issues. There still isn't the degree of coordination that I believe is necessary to make sure, number one, we get the most money for our buck, but that gaps are recognized and addressed appropriately. And having something like a special advisor for health security I think is important at the White House, right out of the White House level. And even better, if possible, for that person to have some oversight or some influence on how budgets are moved around or compiling a global budget for health security issues. So that's the leadership and governance issue. The second thing to me is the will issue. So it's nice to hear you talk about One Health. So Dr. Lonnie King, who was most recently the dean of the College of Veterinary Medicine in Ohio State, previously at Michigan State. I worked with him about 15 years ago to establish the first One Health Center at CDC, at that time affectionately called ZVED. We were vowel challenged, obviously, but zoonotic and vector-borne and emerging diseases. So the One Health concept has been out there at least for the last 2 decades. We made a concerted effort at CDC to try to elevate that to a national center level, and I think we need to continue to support that effort to have people understand what One Health means and make sure we're thinking collectively of One Health. You know, West Nile, if I was having this conversation with you in 1999, we wouldn't be talking about Zika and Ebola. We would be talking about West Nile, and somebody would say, why did we fail to put the birds falling out of the sky, connect that to people showing up in the Bronx with headaches and brain inflammation, right? Why do we not put those 2 pieces together? So we are, we've made progress. We've made quite a lot of progress since 1999, but we have a lot more to do, and that requires will. I've seen that will once before in the federal government around avian influenza, so this was a big issue. Everybody was concerned about the bird flu coming from China, and there was a cross-government plan. People were working really well together. That prepared us for when H1N1 obviously showed up. So there are models for how we can make this work, but we need the will. And then the third one is obviously resources. I have seen the consequence of cutting budgets for state and local preparedness, which is where my heart will always be. Public health. When I was at CDC, I told people public health doesn't happen in Atlanta. Trust me, public health doesn't happen in Washington. Public health happens in your local communities. And how are we supporting that initial detection and response in your local communities? And how do we make sure we have the necessary surveillance tools, laboratory tools, to make sure that we can mitigate any impact of these diseases in our community? Thank you, sir.
Well, Dr. Khan, thank you for your eloquent and passionate statement and your good advice. I like the leadership, will, and resources. I want to come back to that in questions, but we also thank you for your public service. Dr. Lechtenberg.
Good. Thank you. I'd like to express thanks to Senator Daschle, Mr. Weinstein, and the rest of the engagement team from the Blue Ribbon Panel for coming to Kansas State, to Manhattan, and to the heart of cattle country. I'd like to also thank President Myers and the K-State team for inviting me to participate in this meeting. Further, to commend the work on the Blue Ribbon Panel on your national blueprint issued in 2015. Most of us engage the federal government once a year on April 15th, periodically at election time and in the time of national crisis. We enjoy the luxury of assuming that someone's watching out for us and someone's taking care of us. Allows us to focus on our efforts on our families, building our businesses, creating jobs, and doing the things our economy is based on. And so we thank you for that, for this effort. Really helps protect that luxury. But it's further recognition that there's much to do and many opportunities yet to address. It's my hope that the communications and the relationships that develop during your trip to Manhattan can help link the silos that still exist in government, academia, and the food industry. The role of agriculture and national biodefense cannot be emphasized enough. Ag has long been one of the most important components of our national security. We have the natural resources and infrastructure to be the most efficient nation on earth. It's helped us drive our efficiency, but as been pointed out, the same attributes of our production system in ag that drive our efficiency also make us extremely vulnerable to accidental or purposeful attack. And so that is much of the basis of what the panel's here today to discuss. The scope of the endeavor is really broad and pertains to much more than just production ag. But I would applaud your first effort that you recognized in recommendation, and that is to centralize the point of authority for national biodefense. As was pointed out after Dr. Marsh's presentation, the state of Indiana apparently did that very well and can serve as a model for many of the activities that we have as challenges for ag biodefense. One of the statements that I use in our staff meetings when we start on projects and when we end on projects is a flippant little great plan, what could possibly go wrong? And the reality of it is many, many things can go wrong. Almost everything has to go perfect, but much can go wrong on any given plan. And with respect to biosecurity, it's oftentimes the weakest link. It's the haphazard event. It's someone being above policy or taking shortcuts that oftentimes cause the shortcomings of some of our systems. In addition to having a contract research organization business where we help vaccine and pharmaceutical manufacturers approve products for veterinary use and for biomedical use, I'm also a cattle feeder, and we have a corn and soybean production system in Nebraska. I can tell you that as a producer, we generally consider our risk to be supply-demand related, and we try to manage those supply-demand risks of our business through conventional plays on efficiency. We try to do the most efficient production systems that we can. It's no surprise to anyone in this room that the implication of ag biodefense dwarfs any of our risk concerns. The sorts of things we're talking about today simply take complete businesses out of the picture for the rest of time if it's not handled correctly. With respect to surveillance and detections of disease within the food system, I'd offer the following points for consideration. The list includes many things that have been talked about today, many systems that are already in place. Some have been successfully implemented. Others need to expand scope to train individuals to apply for good systems in other states. With Indiana as the example, systems that work well, we need to enhance and broaden the scope of those, learn from those positive examples as well as failures that have been encountered along the way in other systems. A few talking points from the perspective of a food animal producer and a food animal practitioner. Again, Dr. Marsh touched on this, Dr. Beckham touched on this, but my first recommendation would be that we further implement and enforce a national premise ID and traceability identification program for food-producing livestock. We can accomplish this, and we should. It's one of the first questions that containment officials will ask when a population, when a disease breaks within a population, is where are the animals, where are they physically located, and how many are there, and what's the current status. With application of the technology that we have available within our systems today within REACH, this is not an unsurmountable task, and certainly can be implemented at the state level and coordinated nationally. I think we need to review the policy of livestock indemnification to help mitigate the risk of financial devastation for producers that are at risk of failure to participate, at risk of not doing the right thing. Dr. Marsh's comments on the state of Indiana and how well they handled that, I think is admirable. It may not be intuitive to assume that all producers will always do the right thing for the nation's best interest at the right time. A properly reviewed indemnification program can help assure that that happens. We're talking about the difference between bioterrorism and rapid detection so that we have producers that everyone is fully engaged and fully ready to call the ADR as soon as they can possibly see it. I think we need to explore the implementation and deployment of rapid identification systems for pathogen detection. Double-edged sword, we have technology that allows diagnostics to happen at veterinary clinic levels, even at farm levels, that are not the same thing as we're doing in our federal labs. Of course, the trade-off is we need to make sure that those are appropriately sensitive and specific. So we trade off rapidity, or you run the risk of trading off speed with accuracy. But I think we should further explore the question, are we doing everything we can to get early diagnosis and detection, and how do we control that information? We're doing some work with companies that are utilizing cloud-based systems for business management. The one we're working with, it happens to be looking at cropping systems where you have almost continuous connectivity with equipment manufacturers, with seed companies, with fertilizer companies. When you take that same type of platform and apply it to veterinary medicine, it's conceivable that you could be getting real-time data back from many of these farms that have diagnostic implications in a continuous fashion. And the risk, of course, in terms of cybersecurity is how do we manage that data? How do we keep faulty data from becoming too widely dispersed until action can be made? But my suggestion would be there's opportunities for applying the existing technologies and fully implementing that that will require some effort. A surveillance program can be part of that, but the detection of foreign animal diseases and foreign crop diseases, as well as zoonotic diseases, with a more robust surveillance program. It will take some questions, which ag products should be tested for surveillance, for which pathogens should we test them, how often, what type, where, and then how do we summarize that data into something meaningful. But the creation of data on surveillance pathogens of interest is certainly critical, and we have the capacity to do better than we're currently doing, I believe. I think we need to increase the hands-on training for food animal veterinarians that are in the field in the swine, poultry, and beef cattle and dairy operations to help assure that the likelihood that we'll get rapid early detection is the very best that we can do. Domestic diseases have an explosive potential to affect our food supply as well as mimic transboundary diseases. The transboundary diseases are our ability to recognize those early and transmit that data to regulatory officials is paramount. Recognize diseases with zoonotic potential. Anthrax and influenza were both brought up as examples of those opportunities today. We mustn't forget toxins and disease risks that can cause lack of security in our food supply that may not be infectious in nature. There was a case in the Midwest here just in the last year where a car battery for nefarious reasons was lobbed into a feed mixer and killed a large group of cattle. So a purposeful event. While that wasn't a national scene type event, there are risks and opportunities for transmission of that information that we could disseminate, and we need to think about point source toxin contaminations in our systems as well. I'd like to suggest that more specific training for food animal veterinarians, being exposed to purposeful and hands-on training for infectious diseases of domestic origin that would mimic foreign animal diseases, is an opportunity to help increase the likelihood that we'll pick up on early detection. Dr. Higgs mentioned this morning the veterinarian that recognized early that West Nile virus didn't look quite like the St. Louis virus is big print. When we have purposeful induction of food animal diseases like foot and mouth disease, malignant catarrhal fever, for instance, the ability to recognize those in their pure unadulterated state from IBR, from BVD virus, the ability to differentiate tuberculosis from Mycoplasma bovis infections in cattle. There are currently biosafety level 2 challenge opportunities that we could use for training in fairly low expense environments. So it would really enhance the likelihood that our practitioners in the field would go out and recognize differences when they see them. I'd like to incorporate public health official training as part of that process and engage public health professionals from the human medical side more into food animal production so that they can understand our food production systems better. And as we develop a select group of professionals that understand the nuances of production, I think it will serve our nation well. A note that I made during the proceedings today, it occurred to me when we talk about food, something that escaped our discussion so far is lest we not forget water. The most important nutrient of people and livestock has great opportunity as a surveillance tool. It has great risk as a tool for purposeful contamination of our food supply. From a surveillance perspective, there may be selected areas that we could test effluent runoff from ag operations and create a database that don't involve thousands and thousands of tests every year, but would involve selected points of interest for us. While there's an overreaching policy front, Agrodefense will require hundreds of very specific procedures and cross-checks. The list will continually be based upon and will continue need to be amended based on our production systems, the advancement and development of new technology, the application of that technology, and our awareness of producers and consumers to remember that the stakes are very high. Fewer emissions are nobler than our need to ensure a wholesome, safe food supply for our citizens. I'd like to thank again the panel for your commitment and for your trip to Kansas.
Well, Dr. Lechtenberg, thank you for your comments and your wisdom and the very thoughtful advice you've shared with us. I especially appreciated the fact that you emphasized water. You're right, we haven't spent the time, we could spend the day talking about water, and I appreciate your emphasizing its importance. All three of you have talked about the importance of the implementation of these policies. And as we consider the national strategy for biosurveillance, I especially appreciated Dr. Beckham's emphasis on how critical it is that we implement. And we've been talking all day of the need to turn words to action. And I guess I want to come back to that for a moment. I really liked Dr. Kahn's very succinct summary of what I think implementation entails: leadership, will, and resources. But if we could, I'd like to take just a couple of minutes to drill down on what do we mean by implementation? Can we elaborate a little bit more and be as concrete as possible in talking about a time frame and talking about what implementation means in your mind? Dr. Beckham, let's start with you.
So we have the technologies today to implement a really robust biosurveillance system where we can get ahead of the game and, as we talked about a little bit yesterday, get left of boom. Some of that work has been done in the livestock sector, in one of the centers of excellence, actually, at Texas A&M when I was there. It was a tremendous effort called Enhanced Passive Surveillance. So we began to develop real-time applications for working with our veterinarians and our producers to collect information in the field. So what does it mean to implement something like that? I mean, I think you have to clearly work with the producers and the veterinarians. You have to be communicating with them on how that data is going to be used, what type of data you need, who's going to own that data, what decisions are going to be made off of that data, how's that data going to be linked to who's going to have access to that data. And then mostly and foremost, you have to work with them to provide them incentives to use it. So for the production systems example, how can we collect information that we can also provide back to you that will enhance your production? So how can we give you a competitive edge? So whether it's in the poultry industry or whether it's in the swine industry. And then how do you link that with what's going on in the secure food supply plan? So how do you capture the movements that you're going to need to be able to do the permits that Dr. Marsh talked about earlier? So how can you give these guys a one-stop shop to put their data there, but to be assured that it's going to be safe, have the confidentiality around it, and also be able to effectively use it and tell them how and when you're going to use that data. I think, too, in the federal government, we tend to, the systems overlap. You know, I've heard a lot lately about antimicrobial resistance surveillance system. Why on earth are we not looking to collect all of this data together at the same time, using the same systems that can actually communicate with one another, right? Data standards, hugely important. Capturing data from the D labs and the human labs and being able to marry that. So on the other end of that, some of the vision for NBAF, I think, too, is having a more robust epidemiology capability, being able to work with our state vets, being able to provide that feedback back to them so that they, too, can use that data to go out into their states and work with their producers and the production systems and get an edge on that. So what does that look like for implementation? Obviously, you've got to have the governance, and you've got to have some central authority that's going to hold people accountable for developing a system and putting it out there and working with the producers. Those things take time, building that trust with the producers and building that trust with veterinarians and across the aisle, I guess, on the medical side, too. It's going to take a lot of time and a lot of relationship building and a lot of trust that has to go into it. So, you know, you're not talking about something that's going to happen in a year. The technology's there today. But building those relationships, communicating, being transparent about how that data is going to be used, the governance has to be central. It has to be oversight. You have to bring in all these different components. FDA can't be thinking about capturing information on antimicrobial resistance and USDA too and not communicating with the other databases that are being developed. And so I think that's critical. Got to have the money to sustain and support something like that. So what do the production systems get out of it? I mean, initially when we started our program, we were paying for their service on the applications to get them incentivized to use it. But ultimately, the goal was to move that out to them and give them some useful data so that we wouldn't have to do that, but it was self-sustaining. So how do you sustain that? What's the monetary figure that goes along with that? What happens when you get an alert off in a system and you have to send that sample to the diagnostic lab? Who pays for that? So all of those types of policies and procedures have to be worked out as well. And again, that's going to require some thought centrally and communication with the producers and the veterinarians and then on the medical side as well. So there's all of that. So governance, policies and procedures, and funding. How do you sustain something like that long term? And hopefully it becomes somewhat self-sustainable in the effect that you're incentivizing people to report into that system and they're getting something out of it. But at the same time, somebody's got to pay for the diagnostics and the follow-ups and the alerts that happen off of that. And then somebody's got to be there to work with the state vets and the producers and the veterinarians to give them that data back. And then you've got the whole crosstalk with the human side, making sure those systems can communicate and talk to each other. And for me, that's a multi-year implementation. But again, central governance, central oversight, and accountability so that people aren't creating multiple systems that don't communicate. I mean, why would we do that?
Somehow I have the impression you've given this a lot of thought.
I did that for a few years, and so I was very passionate about it because these guys want to work with you and they want to give their data to you. They want to make sure it's used well. They want to make sure they get something back out of it. And it's a tremendous opportunity. I mean, and again, you know, when I read that they're developing systems for antimicrobial surveillance, why are we not using these technologies and doing the same thing? I mean, realizing you collect different data for different things, but you shouldn't create duplication.
Dr. Khan, I especially appreciated your comment about the need for leadership, basically through what you described as a special advisor in the West Wing. We have, as you know, in the Blue Ribbon panel, have talked about delegating that responsibility to the Vice President. But could you elaborate a little bit more, given your experience at CDC, why you think that's so important, why having somebody in charge close to the President makes a difference?
I think what we just heard about data and surveillance systems is that example. There are too many systems that are siloed and people don't talk and work well together. And I think having that central leadership could really assure that necessary coordination. And, you know, we started to talk about data, so let me stay in that realm, why leadership would really matter in this space. And I think about things like veracity and timeliness of data. We have too many data systems. We have lots of sources, which is a good thing, but we have too many data systems that don't talk to each other with different types of ownership of that data, and it's made it difficult. We've attempted this previously. There's something called the National NBIS, National Biosurveillance, NBIC, Intelligence Center, right? We've attempted this, and it would have been successful with better leadership, to be very honest. I believe it would have been successful with better leadership. But, you know, all these data systems don't make sense, at least from the human health side, when we know most of this is already captured when somebody walks into a hospital, walks into a clinic. That electronic record is created instantaneously. Why do we need to have multiple intermediaries? Why do we not have systems set up that capture this immediately when somebody walks in the door, the moment their lab test turns positive? I think we need to be thinking of surveillance and detection very differently than we ever have previously from a human health standpoint, and that would take care of veracity issues, that would take care of timely issues. And then we have the tools, we just need the will for the data fusion part. How do you put together who went where, to what they ate, to where they traveled? That data already exists, and we see interesting uses of that data. For example, during foodborne outbreaks, you can look at the cards people swipe at grocery stores to figure out what grocery store they went to and what they bought, and that can help you lead you towards a potential source. So data is just one example, but that's the same thing's true in medical countermeasures. It's the same thing's true in response, that having that leadership would really help us nationally be better prepared than we currently are.
Thank you. Dr. Lechtenberg,
Yes.
any further comments on implementation?
Well, from the surveillance perspective and the access to the testing equipment that's out there, I think part of the implementation associated with that we're lacking is identifying the bottlenecks, where we go to find common reproducible point sources that we can sample and build a database. The one thing that's different in veterinary medicine from a diagnostic laboratory submission perspective, with the case of infectious disease, just diagnosis is pretty similar to human medicine, I suspect. But we tend to do sampling on dead animals and not very much on, not quite so much on living animals. So discrepancies in database, it's important to remember what your base population is. With respect to antimicrobial resistance, pretty important difference. With respect to some of the infectious diseases we've talked about today, less so. But I would agree with Dr. Khan that the data to do more productive work with already exists. It's a matter of getting that data coordinated, getting folks to allow it to be shared, and then creating systems that make that combination of data and interpretation of that data possible. It's probably one of our largest low-hanging fruit opportunities.
Very helpful. Thank you. Dr. Khan?
If I may, Senator Dash, I'll add to that leadership issue. So I think nationally we've already admitted we need an advisor, because during the Ebola outbreak, some will remember that even though it was ridiculed, we created an Ebola czar. So the reason for the Ebola czar was because Department of State was sort of doing what they were doing, Department of Homeland Security was doing what they were doing, Department of Defense, you know, you all read it as well as I did. And that was the reason an Ebola czar was created. And all you have to do is strip the Ebola piece off of that and strip the czar piece off of that. And you sort of get that sense of you need somebody to coordinate. These are very complex responses that require coordination across the federal government, and to try to do it as we have done previously doesn't work as well as it can. And the same thing's true at the international level. So Dr. Navarro was brought in once again at the UN level, not at WHO, but at the UN level to sort of serve that role, because what you need is that discussion with the chief executive of a country, not just to the minister of health of the country, when you think about what the implications of these diseases are. And so WHO's interaction is with the minister of health, which is excellent and needs to happen. But when you have something like a global pandemic, what you need the UN secretary talking to the president or the prime minister. That's a different level of interaction.
Thank you. Ken?
Thank you. Dr. Khan, I'm going to start with you. You had a historical allusion in your remarks, and I think one of the best panels we had last year was involved a discussion of some of the use of chemical and biological weapons in the past. And you referenced in passing the use of glanders in World War I, and it piqued my curiosity, that teaser, and I had to ask about it.
German agents against Russian mules and horses. So mules and horses were really big in World War I. Also big, I think, into almost World War II. But by World War II, it wasn't as big of an issue. But World War I, this is how you moved troops and this is how you moved goods. And it's the same thing as what today would be an EMP pulse against cars. You just can't move stuff anymore if your horses don't work.
And glanders?
Oh, I'm sorry, glanders. The glanders part.
Still got glanders on my brain.
It's a bacterial disease of animals.
Oh, I see. Okay.
So I'm sorry, glanders is
Intentionally used of it?
Burkholderia mellii. Pseudomellii or mellii? Mellii. It is mellii. So it's Burkholderia mellii. It's a bacterial infection of the animal that makes the animal sick and or die.
I see.
And so if you kill the animal, they can't pull that card anymore.
I see. Okay. And then you also mentioned the National Health Security Index. You said that we're at 6.7 out of 10. Do you have any sort of, can you give us any deeper understanding of how that index is calculated, what goes into it?
So it's a composite index that was established 3 years ago to specifically answer the question, how prepared are we? Because often there's a significant federal investment. I can tell you at CDC for the healthcare preparedness program, it's almost, it used to be $1.5, $1.7 billion. Now it's closer to $1 billion. But you make that sort of investment, and people want to know, what are you buying with those dollars? And we would always list a list of programs that were being bought, but really couldn't say how prepared the nation was. And so that was the impetus 3 years ago to establish this National Health Security Preparedness Index. We were very careful that it's not a CDC index. It's actually supported by the Robert Wood Johnson Foundation, currently out of the University of Kentucky. So it's independent of the federal government. It's a composite, so you look at various measures in those domains I gave you previously around surveillance and response and detection and information systems and countermeasures. And so there's various metrics in those, and there's a system to put those together and give you this composite score of 6.7. The score itself, to be very honest with you, is meaningless, because it just depends on how you do the math to get your number, right? What's more meaningful is what happens once you've decided what your number is. What happens to that number over years? And I can tell you, it's not budging over year. And the other thing that's meaningful is how close is that number to what you think perfect looks like. Right, so if we've established based on these metrics that 10, you have a plan for moving stockpile. If you have to move a doxycycline or ciprofloxacin in a community, you've got a plan. You can make that happen. We're going to give you a 10 on that. So how close are you to the 10, and how do you do over time? And so that's how I would evaluate the 6.7. We're not close to the 10, and we're not getting better.
Okay. Great. Thank you very much.
Could I just follow up on that, Dr. Khan? I guess I'm curious. We had, I don't know if I would say ample information, but we had quite a bit of information on Zika and Ebola prior to the outbreak. And I didn't see much evidence that we used that information in advance to prepare adequately. And so in some ways, I think the 6.7, at least in that context, is generous. But I mean, could you elaborate a little bit more? Why, given the information we had, were we not more prepared? Even though I have to say, given the ability now to look back, we can be thankful that we were able to contain it, and we dealt as effectively after the fact as we did. And great credit goes to to everyone involved. But I'm just curious as to the lack of advanced preparation, given the information we had, and what lessons can be learned from those experiences as we look forward.
Thank you for that question, Senator. So there've actually now been published a number of very good papers and studies on the lessons to be learned from the Ebola outbreak, both at the global level and at the national level, to not really appreciate how this disease was so different in West Africa compared to what we were used to seeing in East Africa. Ebola outbreaks occur in East Africa all the time. Nobody bothers to call a response because the communities know how to take care of it. And the expectation was the same thing would happen in West Africa, not recognizing what had happened with the civil wars there and the fact that they had never seen it previously. And that's why the disease got to spread. The response was extremely slow. And didn't use data to understand what was going on in the communities. In the United States, we failed to make sure that the healthcare system was ready for these cases. You can't build a wall around the U.S. for infectious diseases. People will walk in, seem absolutely fine, and then because they move faster than the incubation period, which is the time it takes to get infected, to get sick, so you walk in the door, you're absolutely fine, and then 4 days later you have Ebola, and you show up at your local emergency room. There's no way to prepare for that, so we need no way to prevent that by sort of border screening. So what we need to do is make sure that the hospitals were ready, and that didn't happen. The response in Texas was not robust enough from our public health officials based on published reports and papers, and that's unfortunate because we should have expected we were going to get cases, and we should have expected that if a hospital didn't appropriately manage the patient, they wouldn't do well. The Zika response, I think, is even more telling. So I talk about infectious diseases as predictable surprises, which to me is a tragedy. Because, they keep happening and we go, surprise. Like, no, it's not a surprise anymore. They keep happening. And so, we knew about Zika for over a decade as it moved out of Africa, across Southeast Asia, and into Oceania. And the moment it hit Yap Island, it moved across the Pacific, it moved into Brazil, and then we saw what was going on in Brazil, and we knew what was going to happen. We knew it because we knew what happens with dengue. We know what happens with chikungunya virus. We know what happens with yellow fever. So you knew that this virus was going to explode. And it exploded. We knew it was going to come to the United States without a doubt. And despite that, people in this room are more aware than I probably am of all the details around failing to fund the public health response until after we had already started to see cases occurring in Florida. Now, I want to be very honest with you because it's my responsibility as a public health official. I'm not sure we would have prevented those handful of cases in Florida. I don't think we would have, to be very honest with you, the handful of cases in Texas. But, we could have been much better prepared to detect them faster, to make sure we had diagnostics up and running, and have all our guidances up and running. There's a lot of stuff that could have been done with additional dollars, including the work, obviously I often talk about the public health CDC side, but, at the NIH side, vaccine development, diagnostics development, et cetera, there's all sorts of other work that could have been done, and we didn't have to wait for this to already show up on our shores before we decide, it's really a good idea to prevent pregnant women from Zika.
Thank you very much for that good answer. Let me ask Eleanor Asha if you have any questions.
I do. I have a question for Dr. Khan. You hit on something that we hit on in our report, which is the lack of a nationally notifiable disease list for animals. There is certainly one in development, and we have encouraged through our reports the finalization of this process, which we understand will go through rulemaking. Can you tell us why the CDC having a notifiable disease list is so important to tracking infectious diseases nationally, and how that paradigm could be successfully applied in the animal world?
So the surveillance systems permit us not just to collect data, but they permit us to act on data. And that's why we have detection systems, so we can understand what's going on and then put together the public health response. Without having any data on what's going on within our communities, there's no way for us to respond. And so that's why the notifiable list of diseases has come together. They're heavily biased towards diseases that are communicable in nature, so something that you could transmit to somebody else, like measles, for example, better be there. So it's heavily biased towards communicable diseases. It also includes all the bioterrorism agents and other diseases where we can actually take some action. So, for example, the foodborne diseases are on this list because it could represent an outbreak due to cantaloupe or due to soft cheese or something like that. And you want to pull that off the market. So, similarly, the lessons to be learned from that is the advantages from the animal side of the house, that if you know about these diseases and you get that information timely, move it faster, you can then you can make a difference in your decision making about the animal or the farm or the community. Does that get to what you're trying to get at, Ellen?
It does, and from a policy level, I'm trying to understand, the CDC list, from my understanding, is a voluntary notification, correct, on the part of states to the federal government, but they do it a lot, right? I mean, despite the fact that it's voluntary, so it's a successful and useful tool.
So this is where money works. So CDC funds many of these surveillance systems within the health departments to collect the data, and you're correct. So it's health issues are relegated back to the states. So the states then in their statute then just pick up that notifiable list, and then they repeat that notifiable list in all of their states. So every state of the union has a notifiable list which very closely matches that CDC list, and occasionally has some extra additional diseases that are of concern to that specific state. But at the individual state level, they understand the value also. So if somebody has, in my state, if there's somebody in Lincoln that has measles, the state wants to know very quickly, because measles may not decide to stay in Lincoln. It may decide to move to other parts of the state, which we know it would. So that's why it's important for the state to very quickly understand what's going on so they can come in and vaccinate people, isolate people, whatever needs to be done.
Thank you.
Asha, any questions?
Yes, just quickly. Ali, we're certainly aware of the University of Nebraska's Ebola Center and utility for training and so forth in the United States. One of our recommendations has to do with creating a stratified hospital system in the United States. And we recognize that we're not going to fund that with the limited funds available in the hospital preparedness program, nor should anybody, think that. That wasn't its intention. So could you talk a little bit about just, your opinion on that? Obviously Nebraska and other places in the United States, there are a few, we called them receiving hospitals, that were developed enough capability to be able to treat patients when they came in, but that's disease specific. We need to do something beyond that. We certainly can't have a bazillion,
Correct.
levels going on for every single,
disease. Correct.
And, again, that's on the human side. One would imagine, one would hope that we would do something on the animal side as well. Now, you've worked kind of on, both sides of the fence in terms of addressing these diseases. Do you think that the implementation of a system like that is possible?
I think from a sustainable standpoint, the only way it's possible is for limited conditions, probably for Tier 1 hospitals. And we need to think more broadly than Ebola, but generally around highly communicable diseases. So if a MERS patient, for example, showed up, we wouldn't like that to be transmitted within a hospital setting. And we know MERS is, Middle East Respiratory Syndrome virus, which is a cousin of SARS. It's a respiratory disease that's spread from person to person very efficiently in hospitals to amplify it. So we don't want one of them in our hospital either. We want them there to take care of them. Obviously, we don't want them there to spreading disease. But, whenever I have this conversation, I have people and ask them to step back to what's going on in the United States around hospital-acquired infections. Right? So we are currently seeing hospital-acquired infections with significant public health impact and economic costs. And hospitals need to up their game, not for the Ebola patient. Yes, they need to up it for the Ebola patient, but they need to up their game so that they're taking care of the line infections that they're having, they're taking care of the C. difficile infections, they're taking care of all of the other infections that we're seeing in their hospitals going on right now. Right? And so that's how I believe to think about these more exotic emerging infections, is you need to be ready for these diseases because you're seeing them already and patients are dying because of your actions right now, right? And that needs to be taken care of routinely, and I think if you take care of that routinely, you will be prepared for these exotic patients that come in. Does that make sense?
Yes.
So I don't think we should be thinking, I've never believed in the break the glass approach to bioterrorism. You know, I think this is something you bake into our existing systems, and we know hospitals have a problem with healthcare-acquired infections. Make them fix that, and you will do a lot better for these bioterrorism and emerging diseases.
Okay, thank you.
Well, let me just reiterate our gratitude to each of you for your excellent comments and the advice and counsel you've shared with us. We will take this into account as we consider our next recommendations and appreciate very much your participation. We're going to take a short 5-minute break, and we ask, if I could, to have the next panel come to the table in the next couple of minutes, and we will return in 5 minutes or less.
Those are off. We're going. Okay, we're going. Oh, there's 4 of us. Okay. I don't think so. You 2 are. We are.
Hey, Tom, you taking off? No, we're leaving.
Oh, you are?
Yeah, we have to leave. Thanks for doing this. Thanks for having us.
Oh, you are, okay. So I didn't. You work with our office in Minneapolis? Yeah, I work a lot with them. Okay, so we're out the hay.
180,000 chickens in that project. That's right, yeah. One out of 10 things being built. Yes, No, that's okay. I was thinking of Andy's feeling. Go
Their supply chain, seal, you know, and it's not just, it's everything. I mean, they're on it, whether there's places that could be broken down, but that's a question they ask. Is where are you making this? Yes. Didn't Dave come up there? Wasn't he there? Yeah. I would like to do that.
Make it really fast. But yeah. Talk to Helen up at headquarters. Are you having mass?
Go ahead, sir.
Whatever you want.
Well,
Do you want me to shift
I
over
want to wait until Ellen.
until Ellen? Ellen's
Yeah.
out.
Oh, she's
She went
gone
with,
now.
with
Oh,
Ken,
that's
too.
right.
So it's just the two of you.
Okay, great. Yeah, why don't you move over here? Perfect.
So we're not squashed on the end.
On the other end.
All right, we will resume the meeting with our final panel of the day. There are those who have planes to catch, and we've lost a couple of our head table here, but we appreciate very much everyone who can stay, and certainly we are especially grateful to our final panelists. Dr. Jackie McClaskey is the Secretary for the Kansas Department of Agriculture, and Dr. Charles Hunt is the State Epidemiologist and Director of the Bureau of Epidemiology and Public Health Information of the Kansas Department of Health and the Environment. And Dr. Curt Mann is the Chief Executive of the Empryse Group. Hope I pronounced that correctly. But I appreciate each of you and very grateful that you've waited the entire day to make your presentations, and we're grateful especially for that. So, Dr. McClaskey, I think we'll start with you.
Well, thank you. And I will join everyone else today in thanking you all for being here. And on behalf of the governor, we're very happy to have this panel here. And just one more sign of how dedicated we are as a state to biodefense and agricultural specifically. You've heard reference today, agriculture is our state's largest industry, makes up 44% of our economy, about $64 billion that it adds an economic activity to our state, and that doesn't include food retail sales. You get into adding food sales, and we're well over half of our economy is dependent upon agriculture and food. Our largest single sector within that is beef, and when you look at animal agriculture as a whole, it's about a $20 billion economic impact to our state. So when we think about the things we've been talking about today, we know and understand that they're important not only to the industry, but our entire state economy. From the Kansas Department of Agriculture perspective, we moved our agency, the majority of our agency, to Manhattan 2.5 years ago, and one of the reasons we made that decision is because of the decision being made that NBAF was here. And I know that you saw our office yesterday. We are officed right next to NBAF, and we see that as a very important message of our state's dedication to this cause. Our state does have the lead responsibility for dealing with an agricultural emergency. Our agency does for our state. In addition, when you look at the statutory authority, when it comes to an agricultural emergency in the U.S., the primary authority lays with the states. Obviously we'll be in collaboration with our federal partners, but when it comes to the day-to-day decisions of how we respond, that lies within our state agency. And I'm lucky to work with an excellent team in that area. We have up in the corner our animal health commissioner, our deputy animal health commissioner, our deputy secretary, and our emergency management coordinator. And that team has worked to put together a very good plan. We take our goals and our authorities very seriously, and we exercise them regularly. In the last 7 years, we've held 5 full-fledged exercises. In the last 4, we've held 4 multi-day exercises that include all levels of government, county, state, federal, agricultural organizations, and industry. We tend to focus on FMD, assuming that if we can find a way to respond to FMD, we can apply those lessons to just about anything else that we might encounter, including the AI cases we had in our state in 2015. When we think about our roles and the things that we do, we also understand the important role we have in helping the locals, which is why our emergency management team has held over 20 small tabletop exercises at the local level in that same 4-year period. During these exercises, there are 3 major lessons that we have learned, and that's where my focus will be today. The first is that there is a significant human resource shortage when dealing with any type of agricultural emergency. First things that we have done to address that is we have made agriculture or emergency response an agency-wide responsibility. It does not matter what program you're in, what division you work in. You might be in water, you might be in IT, you might be in communications, but in the case of an agricultural emergency, our entire agency refocuses on that, and that is the first step in expanding our team. The second piece is we have understood that there is no amount of government employees that are going to be able to serve all of the roles necessary in dealing with an agricultural emergency. So we have established, and we'll be kicking off this spring, the Kansas Agricultural Emergency Response Corps that will be made up of volunteers of anything from veterinarians to appraisers to culling specialists. If you can think about something that would be done in an agricultural emergency, I believe we have over 20 different job descriptions that will be included in that volunteer role, and we think that's very critical to being prepared to respond. We know and we expect to collaborate and partner with the USDA. However, in the case of an FMD outbreak, if we are not the first state, we do not expect that we will see a significant number of USDA personnel in the state. The reality is that we believe we're going to have to plan on the majority of this response, the majority of the manpower coming from within our state and not coming from elsewhere to provide assistance. So that's the approach that we have taken. One of the things specifically related to human resources that we have noted is that we need more FADs, more folks that have gone through foreign animal disease diagnostician training, and that one of the challenges that we find that we think could be a simple solution to be on the list is that training needs to be available more frequently. For example, we hired a new vet in September, and they're still on a waiting list to get into that program. We do appreciate the moving that training to Ames, and we know someday that training will be in Manhattan. But the key to that is if our state, for example, is willing to invest in training another 10 veterinarians, make that resource available to us. Even if we're willing to write the check, let's give us the training opportunity to do that. And that to me seems like a simple solution, but is incredibly important as we've heard about talking about disease surveillance and diagnosis earlier today. The second lesson learned that we've taken from our exercises is that the response plans need to be realistic. And when I say that, that seems simplistic, and I'll share with you some very simple examples, but is some of the frustrations we have had of listening to, here's the plan, and then asking the question in exercise, well, that's not going to work. Why is it still the plan? And how do we address those types of things? And that's actually led us in our own response plan for our state to move from a unified command with USDA to a coordinated command. Understanding the role of those decisions will lay with our animal health commissioner and our team as our policy team, and that we will coordinate with USDA, but we don't see that unified command at this point is the right direction for us. Obviously, collaboration is key, but we just know that we need to move forward to make the decisions that are best for our state in dealing with an exercise. One example of that, where we're not all quite on the same page from state to state and at the federal level, is the stop movement order in the case of a foreign animal disease outbreak. In the case of FMD, the Kansas policy is if there is a presumptive positive case of FMD anywhere in North America, we are going to stop movement into our state and within our state. We'd give probably a 12 to 15-hour notice, kind of depending on the time of day. We've exercised that as well. And then we would stop all movement until we felt like there was some knowledge of how big the outbreak might be. That's very different than other states, and certainly different than what you would see at this point recommended by USDA. The other piece, and the bigger piece, and the piece that I think that there are several folks in here that could talk about for hours, is the issue of culling and disposal versus vaccination. As we have moved in USDA policy from a culling and disposal plan to what is now moved from vaccinate to cull, to vaccinate to slaughter, to vaccinate to live policy, we have severe concerns that that is actually something that we can implement realistically in the time frame necessary to stop the spread of disease. And keep in mind that that is our first and foremost responsibility, is to stop the spread of disease. And so when we start looking at those plans and thinking about what a vaccinate to live policy might be, have we really answered all the questions of everything from consumer acceptance for those animals to the animal welfare that animals might go through if they have to live through the disease in the process in which we're no longer culling livestock. So those are challenges that we have. And one of the pieces, and I know there are a lot of veterinarians in the room, and many of them are my friends, so I ask them not to take this comment personally. I feel like sometimes we have too many veterinarians talking about this, and we are really not creating this conversation amongst policymakers. As a Kansas Secretary of Agriculture, I've yet to be in a room in which I've seen other folks in my job get together and really talk about this issue and start thinking about the fact when a state decides to cull or a state decides to stop movement, all of our governors are going to care about that decision. And we tend to make this an animal health, state veterinarian only discussion. And I have severe concern that as much as that team continues to work together and communicate across states, that we're not getting that discussion at all the levels it needs to be in order to make sure that we really can make the best policy decisions. When we look at specific vaccine availability, you've heard some of those numbers today. USDA estimates that we would be able to get 1 to 1.5 million doses delivered into the state in 7 to 10 days. In another 14 days, we could get another 1.5 million doses. Do the math, 3 million doses in 3 weeks. 3 to 4 months later, we would expect continuous production of vaccine, providing again another 1 to 1.5 million doses per week. That assumes the master seed exists. Otherwise, that number becomes 18 months, right? In our December exercise, we had one major feedlot and one dairy in western Kansas that were infected. In that case, based off the populations within that state, our request was 1.5 million doses to meet our needs. So that would be Kansas requesting the entire availability that was in 7 to 10 days. When told that we would get that vaccine in 7 to 10 days, we felt like we had no other choice but to go ahead and cull those animals and dispose of them, and that's what we exercised. So even though that the policy is to vaccinate, we felt like culling was the choice that we had to make. If we were to give you a number for so we have 8 million susceptible species to FMD in the state of Kansas, and the majority of those are concentrated in southwest Kansas. If we were to give you an estimate of the number of vaccines we would request if southwest Kansas became infected, we would request at minimum 6 million, probably somewhere in the 8 to 12 million doses, accounting for the fact that hogs obviously need two doses. So even the numbers we've heard recently from USDA of they need $130 million to have $25 million doses of each of the 10 serotypes. In that situation, Kansas would still request potentially near half. And we're not Iowa, where there are 22 million pigs, and they need 2 doses per head. So when you look at those numbers, from our perspective, we're highly concerned that they're really, the jumping to vaccine, and you heard this comment earlier today, as a silver bullet, is really a realistic policy approach. And that leaves us concerned with how we are going to get the support we need to respond in other ways, especially if culling is the necessary direction for us. So that leaves us in a challenging spot. Back to why I mentioned earlier, we felt like we needed to move to coordinated command versus unified. My third and last point is something you haven't heard a lot about today, and I feel like it could be a whole other day's discussion, so I'll just hit the highlight of what are we going to do to get our industry back up and running. We've heard the term earlier today about continuity of business. Business in the agricultural industry will stop in the case of an FMD. To pretend that we are going to have full continuity of business, as we talk to industry, we expect it to stop. We're going to stop movement. We know we're going to stop it. The key is how do you stop the spread of disease fast enough to get business back in motion, and then what are you doing to help those producers, those farmers and ranchers that were impacted, to meet their needs? You've heard about indemnity today. There are a lot of questions about understanding indemnity. I understand during the AI outbreak there was a lot of discussion, a lot of frustration between USDA and OMB about how indemnity was defined. Looking at things like, are you going to pay the value of the animals the day before the outbreak or the day after? Are they going to pay 100% or are they going to pay 50%? Is the state expected to come up with a portion of that? What are we going to do for payments for other things related to response? All of those pieces are going to be important. We haven't had a good conversation as an industry, as a state, as a country with our ag finance industry. Ag finance needs to be included in thinking about how we're going to get our industry back up on board. And obviously the other piece then is regaining trade status. The U.S. is not necessarily known for following OIE guidelines, so I get a little skeptical when the OIE guidelines are given back to me of how quickly we're going to get trade status back under a vaccine to live policy. So I think it's important we really think through those implications. The big question is our economy would be devastated in the case of an FMD outbreak. In Kansas, our entire state economy would be devastated in addition to the industry. So the more quickly we can move back, the quicker we can get our economy back where it needs to be. As I close, just a couple of things I might highlight that I heard and I think are really important. You heard from the last panel the importance of traceability. We have done a growth strategy over the last several months and worked with the agricultural industry, and the entire livestock industry in our state is telling us we need a traceability system. So that's something that our state thinks is important as well. In closing, I just thank you for giving me the opportunity to be here, and happy to answer questions about any of these or any other topics you might have. So thank you very much.
Well, Dr. McClaskey, thank you very much for a very powerful statement, and you speak from a wealth of experience, and you certainly have given us a far better understanding of the perspective of agriculture in Kansas and how to deal, especially with the aftermath and how we address the many challenges we face in the aftermath of an outbreak. Mr. Hunt.
Yep, thank you very much. I appreciate the opportunity to speak with you today. I'm going to be shifting gears a little bit. My responsibility as a state epidemiologist is primarily on human health, but I've been listening very intently to the discussion throughout the day today and also yesterday. I think that the stage has really been set for the information that I'm going to be presenting to you. In particular, in the last session, Dr. Khan talked about the importance of public health being at the local level, and so some of my discussion today will echo that. Our ability to respond to any event that crosses the agricultural food safety issues with human health is going to depend very strongly on a strong public health system. And so I'm going to talk a little bit about some scenarios over the last few years, and then talk about our public health infrastructure in the state. So first, I'm going to take you back a few years. It was August 11th of 2009. That was not a Friday, by the way. It was it was a Tuesday. But we got a call. Several patrons that were dining at a local Mexican restaurant in Johnson County, Kansas, became suddenly ill with sweating, nausea, vomiting, and dizziness right there at the restaurant. In fact, they were so ill that emergency medical services had to be called to the scene. The local health department was notified, along with their environmental department, and then they in turn notified us at the Kansas Department of Health and Environment, as well as our colleagues at the Kansas Department of Agriculture, which is responsible for food establishment regulation and inspection. And so they went and they did an inspection, and based on the symptoms and the findings during that initial restaurant inspection, which included refrigerators that were not working properly and some temperature and time violations, we suspected that we were dealing with some kind of a bacterial intoxication, which would explain the rapid onset of illness. And in total, there were 12 people who were reported to have become ill. The Department of Agriculture ordered that the restaurant be closed until the coolers could be fixed, and they essentially rectified the problem. The food was thrown out after we collected samples for laboratory testing, which takes some time. It took about 2.5 weeks before we got the results back, and the results came in on Friday, August 28th. But there was no pathogen or toxin identified, and so we were left kind of scratching our heads, and so we were kind of thinking about this over the weekend. And then on Sunday, August 30th, we got another call. And once again, emergency medical services had been called to the same restaurant. This time there were more than 30 victims with the same kinds of symptoms. So our level of concern increased quite a bit, and so we began talking with federal colleagues at that point. And after the second event, we began to be a little more concerned that maybe we were dealing with an intentional poisoning. And so we worked with the Federal Food and Drug Administration as well as local law enforcement. And I'll kind of summarize what happened in the ensuing weeks, but laboratory testing on additional food samples that were collected did reveal that the restaurant patrons had unknowingly ingested methomyl, which is a restricted use, highly toxic pesticide while eating salsa. As it turned out, this is one of the largest intentional chemical food poisoning events in the United States that had occurred. And then in 2011, 2 former employees at the restaurant were sentenced to 7 and 10 years respectively in federal prison, and they were ordered to pay restitution. And so that was a very different experience for us in dealing with an intentional event. And we have to keep in mind that this occurred in the midst of the 2009 H1N1 pandemic. So we were busy responding to that. There was some discussion yesterday about everything that goes on in public health and in healthcare settings has to go on even when we have a big event occurring. So we were busy responding to H1N1, and as we recovered from that, and we were going on, and then there's been some discussion today about what happened with Ebola, and of course that was in 2014 in March. The outbreaks in West Africa began to become apparent, and we saw that several countries were becoming affected, including the United States. The CDC obviously was very active in response to the international and domestic activities to stop the outbreak. And when the first case of Ebola virus disease was diagnosed in the United States on September 29th, state and local health departments throughout the U.S., along with hospitals and other healthcare entities, really had to scramble to prepare for the potential of additional cases. For those of you who were with us yesterday, heard Dr. Norman talk about the response in Kansas. I think in general, because of the work that we have done in preparedness, I think we were probably a little bit better prepared to respond to that. We had our first comprehensive state plan for Ebola ready to go, I think the first or second week of August, and so I think that we were in pretty good shape. But nonetheless, there was a lot of additional activity going on, and in October of 2014, of course, the CDC implemented the post-arrival and screening and monitoring of travels that were coming in from the impacted countries in West Africa. Again, that's imposed a substantial burden on many state and local health departments. There was funding that came in, of course, with Ebola. But that funding didn't arrive until February 2015. And so, quite frankly, by February of 2015, we were already very, very much in the response and dealing with the travelers that were coming in, making recommendations to our healthcare institutions in the state. And so a lot of the hard work had already been done by that point. And and quite frankly, we're still dealing with the Ebola funding, even though the cases have stopped occurring a long time ago. We're still dealing with the programs and activities that are related to that. And of course, 2015, we've heard some discussion about the emergence of Zika virus. Of course, this was in 2015, the emergence of Zika virus in Brazil in May, and then the recognition that Zika virus was causing microcephaly, and this being the first virus in 50 years to be recognized as a cause of major birth defects. In the subsequent months, as Zika has emerged throughout the Americas, and the concern about pregnant women traveling to affected countries, as well as the risk of importation into the United States, once again, we're seeing state and local health departments scrambling to respond. As many of you are very well aware, CDC had made a request to Congress to secure additional funding for preparedness and response activities. While that was being debated, CDC had to make a very difficult decision to pull nearly $50 million out of the base public health and emergency preparedness funds, the cooperative agreements that were coming to states. And so at the state level, the impact on us was really twofold. First of all, we were seeing a decrease in our basic preparedness funding, plus all the additional work that we had to do just to revise our budgets. There's a lot of administrative work that has to be done with that. Once funding for Zika had been allocated to states, our preparedness funds were reinstated. But again, there's a lot of work that has to go into that. And of course, that process took many months. And once again, by the time all this additional funding comes in, the states are already doing a lot of the work. And so I think it's important to understand that we have to operate on core public health support. And I'll talk about some of my recommendations here in just a little bit. I think it's important to understand that all this is occurring in a public health infrastructure that has some challenges. In Kansas, we have 105 counties and 100 local health departments, and 75% of those local health departments serve populations of less than 25,000 people. 72% of our local health departments in Kansas have fewer than 10 employees, and over a third have fewer than 5 employees. So it's very difficult. A lot of those staff don't have specialized training in public health, and with the breadth of responsibilities they have in running the health departments for their communities, it's difficult for them to take on a lot of additional responsibilities and respond to events as they occur. On top of that, 24% of local health departments lost staff in either fiscal 2014 or in fiscal 2015 due to budget cuts. So at the state level, what that leaves us with is having to provide a lot of intensive technical assistance to local health departments, particularly those outside of the major urban areas. In Kansas, about 50 to 60% of the population resides in the major population centers, and by and large, those health departments are well-staffed, and they can respond to these things. But once you get outside of the urban areas, it becomes a little bit more challenging. So in terms of recommendations, I think I'm gonna reinforce some of the things that were talked about earlier today, and that is, first of all, ensuring that our healthcare providers and our veterinarians receive training and are aware of the importance of public health. It became really apparent during our Zika virus response in particular that it's hard for us to reach outpatient clinicians in particular. We have a health alert network system in the state called KS-HAN, but as the calls were coming in about Zika virus, it was clear that we were not reaching providers. They were not aware of the testing recommendations, for example. They weren't aware of a lot of the recommendations for prevention and control after people had come back from the affected countries. I think it's also important to understand that we have to stop thinking about global health threats disease by disease. When we were responding to Ebola, one of the recommendations, of course, that we had in healthcare settings was to screen patients coming in if they had been to one of the 3 affected West African countries. And so that information was, I think, was well understood. And so many months, even after the recommendations were no longer to screen those patients, we were getting calls from providers asking us whether or not they needed to screen their patients if they'd been to West Africa. By that time, of course, we were also dealing with chikungunya, as Dr. Higgs mentioned earlier. And so what we decided to do was to try and reinforce the importance of thinking comprehensively about travel history. And so we put together some posters and a social media campaign, hashtag Think Travel History, and the importance of healthcare providers when they're seeing their patients, particularly if they're exhibiting signs of an infectious disease, to ask them where they've been. Not if they've been to Sierra Leone or Liberia, but to ask them more comprehensively about where they've been. And we have to ensure that public health staff are trained. Dr. Lechtenberg mentioned the importance of training public health staff in agricultural production and distribution. And I think that I would like to reinforce that. It's important for us to understand this, particularly when we're doing, when we have a multi-state investigation where we think a particular food item has been implicated. To understand how food is produced, how it's distributed, I think would help us in our investigations. There was some earlier discussion today about ensuring that disease surveillance data is available in real time. We've been very successful in Kansas with implementing electronic laboratory reporting. More than 90% of all of our disease reports that come in by laboratory right now are coming in via electronic laboratory reporting. So that's been a big change for us, because back in 2012 we didn't have any of, we were at 0%. And so that's been a big improvement for us. The other thing that's going on is, of course, the emergence of electronic case reporting. This is similar to electronic laboratory reporting, but it's getting information directly from those health records, those electronic health records. And so the idea here is that when certain triggers are encountered in the electronic health record, that will initiate an electronic report directed to the states. We just submitted an application to the Digital Bridge Project, which is an early implementation project to do just that with 5 different health conditions. And so we look forward to getting to seeing if we're one of the selected sites, and we'll be able to implement this. All hazards response is really the basis of preparedness, and as I mentioned, we've got to stop funding our response efforts one disease at a time. It's really difficult for us to spend money, a lot of money all at once that's coming to us. Quite frankly, we don't have a legion of epidemiologists just waiting to be hired for us to deal with Zika or to deal with Ebola. We have to fund public health at a core level so that we can respond to anything that comes along. And as I mentioned, there are a lot of person hours that are spent on just the administrative burden of responding to those funding applications and so forth, and so that we can be fast and flexible. I think that of immediate concern, I do need to mention the Prevention of Public Health Fund that's part of the Affordable Care Act, and again, setting aside the political issues around the individual insurance mandate and so forth. The Prevention of Public Health Fund right now comprises about 40 to 50% of our core infectious disease cooperative agreement. It's called the Epidemiology and Laboratory Capacity for Infectious Disease Cooperative Agreement. And so those funds are at risk. With the repeal of the Affordable Care Act, there's concern that the Prevention of Public Health Fund, of course, would go with that. And to have nearly half of our core infectious disease surveillance and epidemiology funding go with that is of real concern for us. So to give you an idea of what specific activities are funded through that, for the current budget year, all of our cross-cutting epidemiology activities, so we have funding that's specific for foodborne disease and influenza surveillance and for arboviral disease and so forth, but for those events that occur that are not specifically in one of those categories, all of that funding comes from the Prevention of Public Health Fund. We've talked about data systems and health information systems. For the current budget period, all of my health information systems funding is coming out of the Prevention of Public Health Fund. And so there's a real concern for that, and so we're trying to educate policymakers about the importance of that funding and making sure that CDC can continue to support that. So with that, I'll stop, and again, thank you very much for the opportunity to speak.
Well, thank you, Mr. Hunt, and thanks for calling attention to the importance of the Public Health Fund. It's the Prevention of Public Health Fund. I think it's not gotten the attention it deserves, frankly, and I wish there was more of an appreciation of the magnitude of the contribution that commitment has made. We are really pleased. Our final speaker today who's been patient and who's been with us both days, and we are very grateful to Dr. Mann for coming and for his patience, and we look forward to your comments.
Senator, Dr. George, thanks. Senator, I thought you were going to say something about last but not least. Okay.
Certainly not least.
No, I'm glad to be here. And General Myers, thank you, and KSU staff and leadership, thanks for the invite back home. It's nice being here. I'm indeed honored to be invited back to the panel, and as you may recall, I made remarks about 2 years ago, almost exactly 2 years ago, and my message in that January was, do not forget about agriculture and food. So I'm really delighted that we're talking about defending the U.S. agriculture and food supply. My first thing I'd like to say is deja vu all over again. Famous baseballer Yogi Berra. I sat and listened all day, and I could have been back in 2002 for a lot of things. But I also was refreshing to hear Dr. Marsh talk about some successes, and I heard a few other successes too. So as someone who was involved in this from the very get-go, that's refreshing. It's like watching your children grow in some ways. The second thing I'd like to say is omnia mutantur nocet mutamur in illis. And there was a famous Roman, Ovidius, who said that. And that means all things change, and we change with them. So I'm hopeful we can change. The notion of protecting American agriculture goes back to 1881, when the Civil Appropriation Act that year made provisions that were to control and monitor pleural pneumonia in export cattle going to Europe, protecting an overseas market. And for the next 135 years, we have added laws, an act after an act, like adding bricks to a wall. The result, we have built our current agriculture safeguarding system and food safety approach. Then we turned the page into the 21st century, and we had the events of 9/11 and then anthrax October. We added the notion of defense then to this, our safeguarding food and ag, especially defense from a thinking enemy. Unfortunately, those bricks in the wall sometimes do not work well together, and worse yet, at times they do not work together at all. And this is not even talking about the differences between the human side of things and matters agriculture and animal. So there are several ways to approach today's topic as I see it. One is, as we always have, to put more bricks in the wall, or attempt to rearrange the bricks or make them work a little bit better. I suppose there's nothing wrong with that approach. However, I would like to come at the question a little bit differently. Not the brick wall point of view, but from a system as a whole. Much like an ecologist would look at an entire ecosystem and how it works, how it changes, and how it thrives. Maybe even like, General, someone fighting an insurgency. I would like to consider design, political design. Now let me start with a little bit of history and context, and maybe everybody knows this, but it makes me feel better to say it. HSPD number 9, Defense of U.S. Agriculture and Food, was completed, finished it in the summer of 2003, and then it was signed in the next January by President Bush in 2004. It is the only national policy document that attempts to encompass the whole of the U.S. government executive actions related to the protection of agriculture and food. The directive covers what has become the usual Homeland Security topics: awareness and warning, vulnerability, mitigation, response, and recovery. However, it also tried to institute some change, start something, create a lasting mark, such as with outreach and professional development, coordination of budget in certain areas, and research and development with an eye to the future to learn and potentially develop the mission. This all happened, as has been said earlier today, this all happened 14 years ago now. And while I think it was a worthy effort at the time of policy, it was only a first step. And unfortunately, no other real presidential or administrative policy steps have occurred since with respect to the biodefense of agriculture, food, and water. I echo Dr. Lechtenberg. Water is important. The directive and the overarching policy has not matured. It has not changed, but the times have. It was never treated as a living document, even though we described it as such in our speeches at the time. I want to be fair, though. There have been several activities attempting to assess progress or shortcomings of the directive. GEO did some work in 2011. Lawrence Livermore through the BKC, the Biodefense Knowledge Center, did some work in 2014, but that was mostly a progress report in the form of a spreadsheet. This reality of little or no critical review and reinvigoration, not even an attempt to contemporize the document, has disappointed me. HSPD number 9 was a document of ideas and goals to defend and protect our most basic of needs, actually to protect the most elemental level of our national security, that which gives us sustenance, agriculture, and the food we eat. It was meant to be a starting point, the beginning of a new coordination of partners, a call to planning and action. Prior to September 11, 2001, agriculture was barely talked about in the sense of national preparedness and federal response. Yes, there was some thought crowbarred underneath the Health and Medical Services Annex of the then National Response Framework, but this was hollow and it was under control and management of the wrong entities. Food did have its own annex, but it was primarily focused on delivering food in an emergency. The importance of the food supply, beginning at its genesis, agriculture, was simply undervalued and overlooked. After September 11th, the perception of agriculture changed a bit, and from something that is abundantly available, the food changed from something that was abundantly available, just difficult to move and transport in an emergency situation, to something a little bit more complex and important. We made the agriculture base and the food supply stemming from it a national critical infrastructure. Agriculture and food was now recognized as a matter of importance and worthy of executive branch planning and deliberation. Then adding agriculture and food into the family of the Homeland Security presidential directives gave the matter a seat at the national security table with the advent of the then new notion of Homeland Security. Agriculture and a people's food supply does not lend itself well to fit into a national security way of thinking. It's unfortunate, but at least the national security thinking since 1947. National defense is indeed a fundamental necessity of a state, and it is for us written into our Constitution, and rightfully so, a matter of the federal order of things. Furthermore, the evolution of our military sciences, the development of professional armed forces as keepers and purveyors of both offensive and defensive disciplined violence is a responsibility and function of the federal entity in our union. It is not a matter of the region or state or local, with the exception of state National Guards, which have a unique and additional roles, but defense is and should be a federal matter. Hence, it is a centralized matter. Now, defense of and national security of our food supply and the agriculture fountain from which it flows is a more difficult matter. A complexity of thought and design emerges when we attempt to consider agriculture defense, agro-defense, if you will. It does not, nor can it fit neatly into a federal mission by itself. While the agriculture and the food infrastructure belongs to the private enterprise out there, it is also the purview of the states, as you heard several times today. The states have, they're right there on the front line. And if you look at food, again, a private infrastructure, just the food end of the continuum, it is overseen by local government as well, as you just heard a story from our state epidemiologist here. Agriculture and the food system is a decentralized matter. Simple as that. Let's quit fighting it. Over the last 100 years or so, especially in the 20th century, we have evolved into an administrative state in many regards, a type of meritocracy whereby public policies are essentially crafted by experts and elites, then administered by bureaucracies under the belief that that delivers the greatest good to the greatest number. So with the benefit of hindsight, I question if this is the right formula for agriculture defense, total administrative state design. I recognize one of your main themes in the panel's report thus far, your blueprint, is centralized control. I respect that. And you take great effort and you articulate it very well, the reasons for it. I do not quarrel with that at all. I too have spoken in years past when I saw our dysfunctionality within the White House, of the need for certain White House level leadership, sustained and focused in budget coordination in order to make headway with this thing called Homeland Security. But back to agriculture. Agriculture, it's a noun. It means the science, the art of an occupation concerning cultivating land, raising crops, feeding, breeding, and raising livestock. While it is a decentralized matter, it is in need of centralized organization and coordination. Nevertheless, the reality is it is very much a local phenomenon, a person's connection to place and time. It is a culture. It's a way of life. The complexity here thickens. And what should we do with this complexity to serve defense of agriculture? I believe the key words are adaptation, flexibility, redundancy, and communication. And that communication is new pathways and new styles of communicating between the private sector, state, local, and federal. And the goal, a pursuit of balance between the central and that which is decentralized. In the word style of diplomacy in the State Department, we should pursue a policy of balancing central coordination and empowering decentralized function. Allow me to tell you a story. I believe it's a really good story. I'm a product of it. Beginning in the 1850s, there was a movement for a practical education for the practical person in their place and time. That movement culminated in the Morrill Act of 1862, commonly known as the first Morrill Act, setting up the land-grant college system. This initiative marked the first time federal aid was given to higher education. Then 5 years later, this system was further authorized and empowered by the Hatch Act, in providing funds to establish agriculture experiment stations. And as written in 1887, to promote efficient production, marketing, distribution, utilization of products of the farm as essential to the health and welfare of the people, and to promote a sound, prosperous agriculture and rural life. In 1880, the story goes on, 1890, the second Morrill Act was passed, providing appropriated funds to the now land-grant colleges that are out there, and established the 1890s schools, now commonly known as our historical black colleges. In 1914, the Smith-Lever Act was passed, establishing cooperative extension service, and it read, in order to aid in diffusing among the people of the United States useful and practical information on subjects related to agriculture, home economics, and rural energy, and to encourage the application of the same. And 80 years later, in 1994, I was a Congressional Ag Committee staffer. We added the Indian and Hispanic colleges to the land-grant family. There were other acts and amendments to this land-grant story, but the point here is that there exists a decentralized system already owned by the states connected to the federal, built to deliver service to the people. There is a need for a centralized function, I agree, but there is also a need for a decentralized function close to, involving, and owned by the people in agriculture. A system that respects the decentralization and promotes it also satisfies, in part, the need for redundancy. The law of redundancy is the law of survival in biological systems. So I have suggestions. I believe simply reviewing and reworking HSPD 9 like policy for agricultural defense is not enough. But please do not get me wrong, I do think number 9 needs to be reviewed and reinvigorated for our current time. It needs to remain a central organizing doctrine, a living document that is periodically refreshed and always kept contemporary. What I am suggesting is to think broader, to consider the essential organic nature of the problem, the internal and external defense of a domestic, market-driven, decentralized activity. Well, what might this look like? A next-generation HSPD 9-like policy crafted to guide central coordination and strategies, but with the addition of decentralized, robust entrepreneurial networks that perform and support the central. Actually, this is a dream for a thriving, you heard it a lot today, partnership. A partnership in balance, though. Balance between a set of central coordinating functions able to deliver resources and a decentralized group of sensors, doers, and enterprises. A partnership between federal, state, and private enterprise. I do not mean to imply that the legacy mindset we've had of threat encounter or detection or response is in any way in error. These remain paramount. But how might we go beyond that? Decentralize the ownership of certain matters, promote innovation, create incentives, networks of awareness, and education and learning that serves the mission. I think we need to thoughtfully consider the socio-political design with an eye to create outcomes in the form of adaptable entities that embody the long view and sustainably moves and changes with the time and events. With kind thoughts for all my prior government bosses and with a proud memory of my government service, we do not accomplish what I speak of only with the federal government being in charge and taking care of matters. No nanny state, no administrative state. We should strive for a true partnership, a balanced marriage. I submit we should mature our mindset and focus on public-private partnership. You've heard it all day. I'm there. You got my vote. We should think government stability with marketplace creativity, flexibility, redundancy, and adaptability. So now I get to the part I like, and it's some ideas and my what-ifs. What if Congress produced an act, and let's say it's called the Agriculture Defense Coordination Act, that was designed to establish entities to be more nimble and flexible than a federal bureaucracy. And that act built institutions potentially co-owned, or better yet, co-used by the states and the agriculture and food private enterprises. What if that act, in part, created a federally owned corporation to deal with the need, a user-friendly public-private partnership space, a place where interactions could occur, say, in the image of the Tennessee Valley Authority, or the Farm Credit System, or the Corporation for Public Broadcasting. This could be a place outside the brick wall, and an informal, that's important. If you look at any leadership, informal conversations have to occur for good ideas to blossom. This informal could be an informal idea safe zone. And most important, adaptable and flexible. It'd be more adaptable and flexible than the government could be. What if the board of directors of this creation and the working committees and the structures that would be invented with it, of this new corporation, were compromised completely of odd bedfellows, and with the goal to stimulate synergies, ideas, and understanding? The usual suspects would be there: state and ag, emergency response, federal and the federal and state ag and food, regulators and supporters, private sector ag and food enterprises. But let's go and keep going. EPA, entrepreneurial development, leaders and educators, law enforcement, state and federal, corporate C-suite types, especially the VPs for security, intelligence agencies, Department of Defense, and various members of the national security priesthood and the think tank around that. What if the new corporation developed a robust modern communication department that tapped into new social media venues, utilized early warning surveillance apps? I know some of this has been attempted, but it hasn't been attempted outside of government very well. And they track and engage agriculture producers in their online and physical communities. Approach the matter with a certain flair and expertise of the marketeer. What if the act chartered, say, began to endow a 501c3 foundation, for instance, called the Institute, to act as a central clearinghouse, coordination and promotion champion, provide scenario building, game and exercises? They could partner with the federal side of this, with games and exercises between the interested private sector entities, the state, and the federal personalities. And as well as have a basket for interested philanthropic dollars to land in and to go to work. What if the act established a connection to the Department of Commerce, NIST, Malcolm Baldrige, National Quality, Performance Excellence programs, and to establish a new award program on agriculture defense open to both government and private enterprise? The history of the Malcolm Baldrige story is a very fascinating one, starting with quality back in the 70s. What if the act instructed the new institute to a foundation to establish DARPA-like grand challenges, possibly even partner with DARPA, for problem-solving innovative ideas and approaches to homeland security or defense and censoring or detection or social awareness. I mean, you just let your mind roll. There's a lot of things we could think of there. What if the new act included a third Merrill Act and a second Smith-Lever Act to establish agriculture defense coordination and education delivery to and through the land-grant institutions, build, fund, and maintain a permanent, professional cadre of agriculture defense extension agents. I hope that provides some food for thought, some agriculture defense food for thought. So, omnia mutanter, nos et mutama in illis. Thank you.
Well, thank you very much, Dr. Mann. I can't think of a more powerful way to close out the day than to hear about the Mann Act. I'm prepared to call it that.
There was
I'm ready to introduce it tomorrow.
The Mann Act is something we probably don't want to talk about here.
But let me just say, I first of all, thank you for the enormous contribution that you have made in this field for so long. You were very integrally involved with HSPD 9, and your ideas about contemporizing HSPD 9 are extraordinarily relevant today. I share your concern about the degree of progress we've made since it's been written, and I have come back repeatedly throughout the day about the importance of implementation. I asked Dr. Marsh at noon just what he would do to make HSPD 9 relevant in 2017, and his answer was implementation. If you could do one thing to move implementation farther ahead in a more effective way, given all the lessons learned and your enormous experience, what would that be?
Well, I've changed my thinking after 14 years, and, the standard answer would be, throw money at it, give it, strong leadership, get the right personalities on top of it. You want the vice president, and this vice president might be just dynamite at it. But back to my comments, I think we have to skin the cat, if you will, a little differently, and I think we have to empower the field more so that secretaries of agriculture in whatever state you pick can push on the central a little harder and create and for the states to hold the federal entities more accountable. And if you had a federal corporation that is producing reports, analysis, and it also is providing the safe, informal place for the secretaries of agriculture and everyone involved in this space to meet and think, ideas are going to start blossoming, and the federal bureaucracies hopefully will pick up on that. Or there's going to be incentive for them to pay attention. That corporation, not that it's supposed to be their new boss, but it's going to be new competition. It's going to be that new corporation empowering secretaries of agriculture and farmers and ranchers and people in the food business to speak up with this, much like your blue ribbon panelists speaking up for biodefense generally. It gives them a venue to speak louder. Therefore, the bureaucracies that need to be involved in this, I think and hope they would become more responsive. There's another voice out there that is holding them accountable or trying to. And I think that step, I'm not against, let me say again, I'm not against, really empowering some centralized actor. Back in 2004, 3, we used to, in the hallway, lament over, how we should do this better. The National Security Council and the Homeland Security Council, we were dysfunctional. I mean, there was this big, it's a perfect thing for what terrorists exploit, this big gap between us. I couldn't go international in my thinking, supposedly, even though I did, because I befriended national security people, and so I was thinking doing national agriculture defense in Afghanistan. So that was just one personality. How do you institutionalize that? And I think Having a central figure in the form of the vice president, or I used to think it needed to be an OMB, empower OMB more. I could argue this or think about it a lot of different ways. But I agree with you. We have to do that, and that's not the single first step. I think we have to have something on the outside to help create pressure.
Thank you. Dr. McClaskey, one of the things that I think we all have concluded as we've looked at the challenges we face is the importance of collaboration at the federal, state, and local level. And you have so forcefully articulated the importance of collaboration and the work that you've done within the state. If you had to reference or articulate or prioritize the most important components of an effective federal, state, local collaboration, what would it look like?
Before I answer that question, I do want to note something in regard to Dr. Mann's presentation. He spoke very eloquently about the Morrill Act, and I would be remiss if I did not mention, and Sue already knows what I'm going to say, you're sitting at the home of the first land-grant university. Kansas is the first state to have accepted the Morrill Act policy, so it's anytime you talk about the Morrill Act, you have to talk about K-State.
And what year was that?
In 1863. January 16th, or February 16th, correct. So the birthday's coming up.
February 16th.
Yes. So when he was talking about it, I thought that was going to be the next sentence, so I had to fill that part in. But back to your question, I apologize. I think that thematically to me, I think stealing again some words from Dr. Mann, it's about federal coordination and state level implementation. Giving the states the authority to act and work with local counties, I think, is absolutely important. But at the same time, then those efforts have to be coordinated at a federal level. Traceability systems that are different per state are not going to do us any good. I personally believe movement control decisions that are being made and implemented differently in different states are going to cause more chaos than they are going to actually help us in disease response. So what it seems like to me is that we need to be looking at policy approaches in a way that at the federal level we are coordinating and talking about what does this look like, but the input is coming directly from the states and what can we actually do, what can we do on a given day realistically with the resources that we have. They're helping us do that, but the implementation is coming at the state level. That would be my thematic answer to your question, and I think that, for example, stop movement would be a perfect example of that for us.
That's very helpful. Thank you. Mr. Hunt, you talked about One Health and the importance of combining our efforts. How difficult, what are the challenges to combining data regarding human, animal, and environmental health? Could you talk a little bit more about how you look at that challenge and what are the necessary components?
Mm-hmm. Well, I'll echo some of the comments that were made earlier. Again, the data systems by and large are very siloed. One of the initiatives we are trying to do is get electronic laboratory reporting, for example, from our state agriculture and our state rabies lab, even to come into to our department. But the systems are siloed. Even getting all the work that was involved in getting electronic laboratory reporting, it takes a lot of effort to do that. The one thing I did not talk about is our syndromic surveillance program. We were one of the later adopters to doing syndromic surveillance, and this is hospital, emergency department, chief complaint information that's coming in now. I think that is going to be an important component to the surveillance we do. But by and large, a lot of the surveillance systems that we have in place right now still are very dependent upon actions by people. So, the reportable disease system, for example, right now, it's still very much a manual process outside of the electronic laboratory reporting. So that's why I'm encouraged by the Digital Bridge project. For those of you who are not aware, electronic case reporting is part of Meaningful Use Stage 3. So healthcare providers can get incentive money to implement that system. So I think that'll help. But I think the more we can automate these systems to feed us information automatically, the better we'll be able to be to synthesize that information.
Thank you very much. Pasha?
Yesterday and today, we've been talking a lot about, obviously, since we're here, about the role of the state and states and localities, tribes, territories, more so than the federal government. That's one of the reasons we decided to leave the Washington, D.C. metropolitan area and come out somewhere else other than there. And one of the notions that's come up, we've discussed it over and over again, is the fact, I shouldn't say it's a notion, the fact of federalism, the system we have here in the United States. And federalism is not defined as the federal government is in charge of everything and, everybody else can just, we're not autocratic that way. That's not what it is. All three of you have touched on this notion. Curt, you talked about decentralization. We're decentralizing to the states, and so forth. All of you have. If each of you could just speak to this notion, there's a tension between the federal government and sort of everybody else. And it's not that people, up there are doing something bad or wrong or vice versa. We set up the country this way, and it works for us. But there's something special about agriculture, and in fact, something special about health, public health. The people are here. They're not all, stuck in Washington, D.C. all throughout the United States. Dr. McClaskey, if you could start. I would like to know how USDA felt about the decision for unified, a coordinated command versus unified command. How did they respond to that?
That's a very good question.
I think you did it anyway, no matter how they felt about it. Maybe that's isn't the correct.
The folks in the room who know me well, that in fact we did it anyway doesn't surprise any of them. But I would say it was generally ignored. I think that there wasn't really an understanding when we went through our December exercise of the difference in the roles that we were playing. And Dr. Mann mentioned giving states the opportunity to push back. We used our exercise as an opportunity to push back. Our conference calls were challenging, exceptionally challenging. And we really, intentionally pushed back on the pieces that we felt like weren't working for our state. I think what's interesting is while I'm expressing frustration at the same time, and our working relationship with the USDA APHIS team and the veterinarians in that system and the state vet and all of our is excellent. We have day-to-day working relationships. We have the state divided in regions where we may not have a state veterinarian in that area, but USDA does, and we collaborate together. So the day-to-day working relationship is actually fantastic. And I think it's a perfect example of what a federal-state relationship should be. It's the idea of dealing with the emergency that tends to send us reeling. And we had a similar example in dealing with a flag smut and wheat and controversy between the federal level and the state level of whose decision it was to make it public. Because I felt like at some point, we shared this last night, felt like at some point it was my responsibility as the state secretary of agriculture to tell Kansas wheat farmers that this disease existed in our state. And I was getting excessive pushback from DC that we shouldn't talk about it. And so at what point then, whose decision is that? And at one point we compromised at a date. I said, by this date, we will announce it. It was a week later than I intended, months earlier than they wanted me to, but we did it once we made a decision. And so I think it's a really interesting issue because of the excellent working relationships we have on a day-to-day basis. There are other federal agencies we work with I cannot say that about. But in this case, it is great day-to-day. It's just that when it comes to these big issues, and I think the problem is they are so challenging to deal with. No one knows in the case of FMD how we would actually find a way to cull and dispose of the number of cattle we have in Kansas. It seems impossible. But vaccine isn't proving right now to be a reasonable solution, even under the new numbers that that have been lobbied for. So it's just, I think the problem there is that there just isn't a silver bullet. And we're not finding a way to get all the right people in the right room to really let go of all previous decisions and talk about what are we actually going to do, which then leaves us thinking we're going to stop movement in our state and it's our job to protect our state and the folks in it as best we can. So,
Charlie?
Well, I guess I'll go back to something I stated earlier, and that is that I think that it's important for the states to get core public health funding that can enable us to be prepared for and respond to a number of different things and to not fund our response efforts one disease at a time. So I think that's important. The role of CDC for human public health is one of providing more technical assistance and resources and information rather than stepping in and actually taking control. So I think that that's a little bit of a different aspect than it is with agriculture. I think within the state, I think that we have to, we kind of wrestle with the same issues, from state to federal. Within the state, we have state to local health department issues as well. And again, we provide a lot of technical assistance. I think we probably do need to rethink a little bit about the way we're delivering public health services, at least in Kansas. Going back to my earlier comments about the large number of very small health departments being responsible for responding to anything that comes along. And we actually have a working group in the state right now called the Council on the Future of Public Health in Kansas to look at these issues. So maybe the approach is going to be to do some regionalization or to share services across counties. And so we'll be looking at that and making recommendations eventually to improve things.
Okay, thank you. Curt?
Wow, good question, Asha.
Oh, thank you.
You called me out a little bit. I think I approach this not as a negative. And the theme is it's a negative thing. I think we're designed as a country that way, and it's good. This tension, we don't want it to go away. We want that tension. That's probably one reason we're still a country in a form of a democracy. James Madison, who was very much a states' rights guy, became, a Federalist, essentially, with the Federalist Papers, to try and keep the Union together. So there is a balance here. It's a difficult thing. The states, if everything blew up, Washington is only going to be able to send in federal troops if the states want to do something. We could get down to that ugliness. But I think the tension is good. We should endorse it, we should embrace it, we should respect it, and I'm just trying to advocate for a place where that tension can have informal space to not get into a shouting match in the moment of crisis. And who's in charge and who's shutting their borders down, and the president having to give orders to, order a governor not to do something. We don't need to go there, but we could get there with agriculture because it's to people's hearts. I was trying to say, this is important. Look at a state like Kansas. You're going to mess with too many people's lives. So I'm back to the positive on this is I think the tension is good. It's just how we manage the tension. I think sometimes the bureaucracies, the federal bureaucracy, and it works in the state too, get a little too stuck in the mud. And it's human nature. It's like, who's in charge? I'm in charge. And ultimately, if we're going to be a union, the federal has to have a final decision because it involves trade and potentially, national defense in some ways. So, the Fed will always eventually trump somehow or another, but I think we explore the tension earlier upstream, like the old public health analogy. You go upstream to find your source. And the epidemiologist law, we go upstream and try and create, Francis Fukuyama, who's a political social scientist, writes about social capital. We go upstream and try, because we know there's tension there, and we try and build social capital, which is the lubricant that makes transactions occur in life. If there's distrust, you just have a litigation society. So if you want efficient transactions to occur, you should really listen to what Brett Marsh talked about today. There was a lot of social capital going on there because he had trust built in with all his producers. The producers trusted the state government. They knew that the state government was going to come in and do something silly. So that was a wonderful story. So I think, and that only occurs because someone went upstream and thought about it and talked about it and knew that tension was going to be there, and they worked with it and not treated it like it was bad. They treated it like it was good.
We thank the panel. We're very, very grateful to each of you for your extraordinary comments and the wisdom you've shared with us today, as well as the experiences that you personally bring to the table. This concludes our meeting, but before we officially close, let me ask President Myers for any concluding remarks he might have.
Thank you. Thank you, Senator Daschle. Mr. Hunt and his travel story on travel brought to mind stopping through Port Moresby in Papua New Guinea. And you go into the terminal there. I was on a Air Force little Learjet on the way to Australia. So you go into the terminal and you go into the men's restroom, and then the urinals were all lined up against the wall, and above that was a huge sign, the length of these 10 or 12 urinals, and a great big red letters that says, "Warning, if you should become ill after you leave here, please inform your doctor you were in Papua New Guinea," because about every disease known to man and some not known yet are there. So it reminded me of that. There's ways to warn people. That was very effective for me. I would not have forgotten to remind my doctors I'm saying they were fairly relaxed. Thank you all for coming. It's been a pleasure to host you. I've enjoyed these panels. There's a lot of wisdom coming out of these panels. For me, and I think for all of us, and some such great knowledge of what the problem is, both from a technical standpoint and what the problem is to do anything about it. It's just remarkable. I hope it was useful for the panel because I got a lot out of it. And I think everybody in this room would agree that agriculture is part of our infrastructure in this country. I'm not sure everybody knows that or thinks about it that way, but just like railroads or power plants or water or whatever, this is really an important part of our infrastructure. The other thing that came out to me was, and reinforced with my life as the chairman of the Joint Chiefs of Staff, was how you deal with terrorism or violent extremism, however you like to talk about it. And I don't think our country's got that right yet. I think that's a big problem. That's a global problem like we're talking here. This is a global problem, not just a Kansas problem, not a Nebraska problem, or University of Minnesota. This is a global problem. Terrorism is certainly a global problem. It can't be solved by one country, one agency, one whatever. You just can't do it. And yet, and I'll be a little critical here, I think the United States, and I've written about this, over-relied on the military instrument of power and not the other instruments. It really came across that this is a global issue and everybody needs to collaborate, and we need to have partnerships like we've never had before. I thought Dr. Mann's point on how do you mechanize this so it works, there's some pretty innovative thought there, because it doesn't always work very well, even with the best intentions. I'll give you my Katrina story. So I was a chairman when Katrina happened, and I was on the front row of watching the feud between the federal level and the state level, mainly over politics. Not what was happening, but over politics. In the meantime, people get hurt. Okay, and it was gross. And I was right in the middle of that, because anyway, long story. One of the little anecdotes is kind of fun. So President Bush goes down to New Orleans, I think the weekend, it happened on Tuesday, he goes down that weekend. Mayor Nagin came out to brief him. I think it's Mayor Nagin there in New Orleans. And he's been living in the top floor of some hotel that doesn't have water or anything. So the president says, "You want to take a shower and clean up?" He says, "Sure." So he cleans up, comes out. He says, "Mayor, who's in charge of security for New Orleans right now?" Because the intel was saying there are people taking shots. It turned out the intel was wrong, but that's what we believe. Everybody believed that there was a big security issue. And the mayor thought for a while. He says, "Well, that'd be the governor in Baton Rouge." And so later that day, the president was in Baton Rouge. "Governor, who's in charge of security in New Orleans?" She thinks for a while. She says, "Well, the mayor, of course." So, this can really get out of whack if we don't have, Dr. Mann, did you talk about informal space? Whatever, there's got to be ways to do this, that we don't get in those kind of fights when people's lives and our economy and our health is at risk. So a lot of this resonated because I've lived it in a different life. All I know is at Kansas State University, we want to be a good partner. We want to collaborate. If there are any silos here that we need to break down, point me toward them, and we'll go do our best, because this has to be, at least at the university level, an interdisciplinary effort. And so we appreciate having you all here. I've learned a lot. It's been very enlightening, and I think it's going to help me do my job better as in my capacity here at Kansas State university. Again, I thank Ron Truen for helping put this together and everybody that did. And I hope we hosted, folks came from out of town, I hope we hosted you appropriately. Critique us, we'll do better next time. So thank you very much. Thanks, Senator.
President Myers, let me just say, there is no way you could do it better next time because you've done it as well as anyone could possibly expect. We can't thank you enough. I want to reiterate our sincere thanks to each of our distinguished speakers today. As General Myers said, I think they spoke with enormous wisdom, and we've taken a lot of notes. It's all on record, of course, and we'll be taking into careful consideration those ideas and proposals as we write our next set of recommendations. To Ron Truen, the best. We just can't thank you enough, Ron, for all of your help. Sue Peterson, Ken had to leave, Ken Weinstein for making the trip, Ellen Carlin for making the trip as well, my colleague Asha George, Julia Rodriguez, and all of you for sitting through the entire day. We're very, very grateful. It was our first report where we described a scenario involving an attack with the Nipah virus. We spent some time writing a hypothetical scenario that we thought was necessary to give people a better appreciation of what it is we're up against. Well, in our second report last month, we provided an update on the threat, which included recently thwarted plans abroad to use anthrax and to poison food. We also considered the impact of zoonotic diseases, Zika and Ebola. And the panel expressed increasing concern for diseases that move between animals and plants. Well, today I think we heard a great deal about the importance of the implementation of a One Health policy, and I hope we can remember that as we go forward. And for me, the key words were those expressed by Dr. Khan: leadership, will, and resources. We need all three. And I think it's up to us to ensure that those three components are prioritized. Animal, plant, and human threat is real. The impact could be catastrophic, and it threatens our health, our economy, and our very national security. Our job is to take the wisdom we've heard today and turn it into action. We leave energized, and on behalf of the entire Blue Ribbon study on the panel on biodefense, let me thank you all again for being here and for your contribution.
Thank you, Senator.
Absolutely.